assume. That's the USB that they gave me.
Thanks very much. Which side are you going first, Luann? You're gonna go first? Okay. Okay, I think we're going to go ahead and get started with our next panel. People are still coming in. This panel got three folks. We're going to talk about the role of health professionals in addressing the crisis, climate change and public health. Our first speaker is Dr. Luann Brink. She's the Chief Epidemiologist at the Allegheny County Health Department at Pittsburgh. She was formerly with the University of Pittsburgh Graduate School of Public Health, where she was a co-director of the Academic Partners in Environmental Public Health Tracking Project, funded by CDC. Luann has a Ph.D. in philosophy and a Master of Public Health and Epidemiology from Pitt, as to go along with her Bachelor of Science degree in biology from Notre Dame. So with that, I'll turn over the podium to Dr. Brink.
Thanks, Jamie, and thanks everyone for having me. I get the honor and the challenge of following Dr. Goldstein. So hopefully I'm up to the challenge. Although I'm proud to admit that he hit on a couple of topics that I meant to talk about anyhow, primarily public health communication. I was watching the news the other day, and they were addressing climate change because I think this whole week is really dedicated to climate change. And the newscaster was interviewing someone, I think, around energy policies and climate change. And the newscaster looked and said, I thought climate change was just about polar bears. And, it caused my neck to snap up and realize that, I think we, perhaps as a public health agency and the scientific community, are not doing a tremendous service in keeping the public in the loop regarding the challenges of climate change. In fact, just yesterday we had a gigantic boil water advisory in the city of Pittsburgh. Now that's something I almost took it for granted because this has happened 5 or 6 times within the past 5 years. And so we just said, send out the memo on hand washing in the hospitals, and they know what to do with the boil water advisory. But the idea that these things are happening more frequently, that we're dealing with these disasters, whether that be flooding or the pipes bursting because of freeze-thaw, we're almost taking this for granted. My husband calls me in and says, wow, did you see this flood? I said, oh yeah, 24-inch pipe burst. This time it was in the South Hills. And he's sitting there amazed, and I'm like, yeah, it's just another day at the office, literally. So again, thank you for having me. So I'm not a climate change expert. So what I'm going to tell you is how a local public health agency of 350 people are preparing our community to become resilient to these challenges that we're facing. Obviously, maybe not such a great job of communicating the dangers of climate change, but really trying to do what we can to mitigate and prepare the community. So I think a couple people did a survey already on how many people here are in public health, and it's not many of you guys, so I don't feel bad in doing a quick review. So public health is a set of actions that promote an environment in which good health can occur. It includes assessing what needs to be done, determining what and how these things will be done, and assuring that the services and programs are accessible and effective. So at the Allegheny County Health Department, I mentioned it's 350 people serving 1.2 million people in the community. Our mission is to protect, promote, and preserve the health and well-being of all Allegheny County residents, particularly the most vulnerable, which already has been touched on with the issues of climate change. Our vision is healthy people and healthy communities, and we aspire to be the healthiest county in the country. Again, we're 1.2 million people. We have about 20% young people and a little under 20% older individuals over the age of 65. We're a fairly white community, 81% white, 1.9% Hispanic, 13% African American. As of 2016, 8% of our population were uninsured. We're separated into 13 different county council districts, each of about 100,000 people. So our programs and services that we provide as a local health department. We have a Department of Administration, which is about 20 people. Assessment, Statistics, and Epidemiology, that's my bureau. I have about 20 people, and that is about half who do infectious disease investigation and about half that do chronic disease statistics and reporting. We have community health promotion and disease prevention. That's probably about 150 people. Those are our nurses, and it's primarily nurses, maternal and child health, and infectious disease. We have WIC in that department as well, chronic disease and traffic safety in our pharmacy. Environmental health is the other big bureau. That's another 150 people. We have like 20 people inspecting 9,000 restaurants on an annual basis. In addition to food safety, we have public drinking water and waste management, housing and community environment. We have our own plumbing program, and we have air quality that enforces Title V through EPA. In addition, we have another small bureau called Public Policy and Community Relations. That's where we have our emergency preparedness. Again, not to minimize their importance in readiness for climate change as well. Our legal and our public information reside in that bureau as well. Now, as I mentioned, we have about 20 people in our epidemiology division. These are the projects that we're taking on at this point. Many of these you'll see are environmental. I was trained as an environmental epidemiologist. I'm not sure where the philosophy thing comes from. It's a Ph.D., but it's in epidemiology, specifically environmental. So we have an asthma task force. We're working on preventable hospitalizations. We're doing several environmental investigations. I know Dr. Goldstein said that you can't expose one group of individuals to pollution and another to not pollution, but we do get these special circumstances where a plant shuts down and we can check out the same population before and after. And we had a unique opportunity to do that when the Shenango coking operation closed down. So that's an ongoing study. We're looking at childhood load levels. We are doing follow-up from a fire at another coking operation. We have some issues with those in Pittsburgh. We have environmental justice, which I'll talk about as far as our resilience and our readiness in identifying vulnerable populations and communities that will need help. They don't have the to-go emergency kit, right? So these are places where we'd like to step in. We're looking at infant mortality, homicide, maternal mortality, hospital-acquired infections. We do outbreak investigations. We work with vector control around vector-borne diseases, and we just got $5 million a year to work on opioids. My department just received $400,000 for the next 3 years. So that is a big scope of our work at this point. Our infectious disease EPI program does surveillance of infectious conditions, investigation of outbreaks, monitoring of vaccine coverage, detection of emerging threats, and communication to hospitals and providers. We do surveillance of reportable conditions, and some people have alluded to some of these that are associated with climate change. We do assess the burden of disease. We monitor trends, so we watch for these outbreaks. We watch for these effects that might, and look for prevention measures. And finally, we control disease transmission. There are about 60 reportable infectious diseases that we follow, every case of those. We work on those diseases every year, and we report to the CDC. This is our list of reportable conditions. It's fairly comprehensive. Let's get to some of the actual ones that are associated with Lyme disease. So climate change is increasing the geography in which the black-legged tick can survive. It is also increasing the amount of time during the year that the tick is active and feeding. So you can see that the reported cases of Lyme disease in the United States have increased from 4 per 100,000 to about 10 per 100,000 between 1990 and 2015. And I think we already saw this one, actually. I was like, someone stole my thunder. So you can see, now it hasn't really passed to West Virginia yet, but you can see where Pennsylvania was. Do I have a, no. You can see where Pennsylvania was in 1996, and there was a little bit of Lyme disease in the middle of the state, but it was largely in the coastal area. And even like 5 years ago, it's now over the entirety of Pennsylvania. And that was due to those two factors. These are the Lyme disease reports that we've had specifically since 2009. So we went from just a couple of disease reports to about 3,000 cases of reported disease. And that was slightly down last year. So how is Legionella associated with climate change? Since 2000, the rate of Legionella disease has increased 5-fold. So this is a bacteria that lives in warm water. damp soil, and increases between 6 and 10 days after a rainfall event. It's most common in the summer. So what happens when you extend the summer by a couple of weeks on either side? You have more opportunity to have the water at conditions at which the Legionella bacteria can grow. So this is going to be an ongoing problem. You can see between 2000 and 2017 there in the graph, the increase in the United States. Now, I think the rain events are a really interesting opportunity, and it's been touched on a lot from a preparedness and resilience perspective already. But from the infectious disease perspective, it has two potential impacts. This one where, in Pittsburgh, most of our drinking water comes out of the rivers. So whenever a rain event hits the river, it really churns up the sediment, and it sort of liberates and makes it becomes a lot cloudier, a lot dirtier, right? And it's been shown that after a rain event, when the burden of bacteria in a river becomes greater, there's a spike in Legionella cases. And that's similar to an increase that you can also see in gastrointestinal illnesses, particularly in a city like Pittsburgh, where there's something called a CSO. Anybody know what that is? A couple. Who would like to share with the class? Anybody? It's a fun one. It's a combined sewer overflow. What that means, I usually pause for effect on that one. It is what it sounds like. So when the rainwater washes off, because everything is a paved parking lot at this point, right? Or else it's a road or a paved parking lot. So it washes straight into the storm sewers, which, back in the day, before everything was paved over, they weren't being overwhelmed. So the sewage and the rainwater overwhelm the sewers, and then it has to divert straight into the river. So there's an opportunity for bacteria to go straight into the river. Allegheny County has always had 5 times the rate of Legionnaires as the nation. It might have something to do with the fact that we are on river water. Legionnaires disease is something that's transmitted. It's not from drinking the water, it's from breathing the water. In the steam off of the water, a lot of times you'll find it associated with hot tubs, showers. It's come off of cooling towers off the tops of buildings. Does anyone remember the outbreak a few years ago in New York City? It was coming from a cooling tower that wasn't properly maintained, and sort of a mist comes off of the building air conditioning system. So for several reasons, we actually haven't shown an increase of this year, in Legionella over these years. But there is definitely a potential there for those reasons, because of the warming water and because of the increased number and severity of the rain events, which you can see due to the warm water. Most of our Legionnaires cases do occur between June and October annually. So we talked about resilience. So as a local health department, we're monitoring things. We're monitoring conditions that are sensitive to climate change. We have also created an environmental justice index and prioritized communities based on these various indicators. The EPA and Pennsylvania Department of Health environmental justice really is just poverty and race. That's all that they've incorporated into prioritizing these communities. We've tried to take this a step further and not only look at their vulnerability due to their poverty or disenfranchised status, but also due to their risk by living proximately to these, something that could harm them, to place it simplistically. So we looked at particulate matter, we looked at vacant housing, we looked at poverty, we looked at railroad tracks, and I believe proximity to a river as well, because we did want to look for the potential flood events. And this is what we found. We had 7% of our tracts in the highest need category, and there was no single indicator that caused the high scores. And those census tracts had consistently high scores across all the indicators, which indicated that there are environmental justice issues within Allegheny County. And these are communities along our rivers. They are generally more poor. They're also places where our industry is located or was located. And oftentimes, well, specifically where our industry was located, many of those areas people have moved out of. So the housing prices really decreased. And some of our city communities really have gentrified, and the prices have increased and driven people of fewer means out to the communities in the southern portion along the Mon River. So we're very happy that people have prioritized, including Alcosan, which is our sewer authority. They've prioritized infrastructure projects in some of these lower means communities to perhaps help their resiliency. By comparing our environmental justice communities to the states, we can find that we were able to prioritize a couple different communities because of environmental issues within those communities. And I will say that Pittsburgh is one of the 100 resilient cities. So I do believe, although we are just now approaching the point where we're doing a climate plan, these were not intentional things that we had undertaken because of climate change. We're aware of climate change. We're doing our job and prioritizing these things, and very happy that we're sort of reaching this point where we're going to begin our climate plan. And I think that we have a good baseline for that. So in summary, as a local health department, we're going to continue surveillance and mitigation of the conditions that are associated with climate change, including asthma, air pollution, vector-borne disease, and waterborne disease. Continue to prepare for public health emergencies by identifying those vulnerable communities, and continue environmental enforcement to prevent those conditions, as mentioned above. So thank you very much. Thanks, Jamie.
Our next speaker is Ned Ketyer. He's a retired pediatric physician. He retired from pediatric practice in January 2017 after 26 years of office-based practice in the South Hills of Pittsburgh. He currently serves as a consultant for the Southwest Pennsylvania Environmental Health Project, where his primary role involves reaching out to health professionals to raise awareness about the health effects linked to unconventional natural gas development in the Marcellus Shale region. So with that, Dr. Ketyer.
Thank you, Jamie. So I am a pediatrician, a recovering pediatrician. I've been retired for a couple of years. I had the pleasure yesterday of being in downtown Pittsburgh for the youth climate strike. It was very impressive, very inspiring. They had hundreds of students, some of them my former patients, so I was very, very proud of them. And it's nice to see that people are really starting to show up and speak up about the climate crisis, especially young people. Physicians are also concerned about the climate crisis, and their concern is growing. How to discuss these issues with patients is another matter, and I think physicians need a little bit of help. So we're going to look at the healthcare provider response to the climate crisis. So why are medical professionals concerned about the climate crisis? Climate change is harming human health, especially the health of vulnerable populations, and those vulnerable populations happen to be our patients. Climate change threatens access to clean air, safe drinking water, and healthy and nutritious food and shelter, which, the possibility of good health depends on these basic items. Climate-driven extreme weather events are impacting healthcare access and delivery, and that's important because as climate disruption advances, there's going to be more need for access to healthcare facilities and providers. The health sector has a significant climate impact, accounting for nearly 8% of greenhouse gas emissions in the United States. That's a lot for one sector of the economy. The healthcare sector has a moral obligation to protect public health by using its influence to promote climate-smart healthcare and climate solutions. And finally, physicians can use their voices and expertise. In fact, physicians must use their voices and expertise to educate parents, the public, policymakers, and health administrators about the health impacts of climate change. The health impacts of climate change demand immediate action, says practically every public health and medical organization in the United States and on the planet. The Medical Society Consortium on Climate and Health now has 24 member societies, including my own American Academy of Pediatrics, the American College of Physicians, which represents tens of thousands of internal medicine doctors, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, as well as specialty groups, allergists and immunologists, and psychiatrists, as well as the American Medical Association. And so these medical groups have come together and they formed a statement. This was released back in June. The health, safety, and well-being of millions of people in the U.S. have already been harmed by human-caused climate change. And health risks in the future are dire without urgent action. So these are what your doctors, what my doctors, what your children's doctors are starting to come to grips with and starting to say. So, when I started talking to physicians a few years ago about climate change, and I do a lot of talking with physicians and nursing groups and other health professionals about the dangers, the health dangers, but also the climate impacts of shale gas development and petrochemical development. You have to remember in Southwest Pennsylvania, we're fracking not for methane that heats our homes or gives us electricity, but we're fracking for ethane in order to make plastic. That's what this whole thing is about. And make no mistake, fracking is a disaster for the climate system. And for a few years, I kind of felt like I had to convince physicians, convince nurses that climate change was happening and was a risk. But it turns out medical professionals, by and large, they get it. They understand. I don't really have to convince them. And our patients, I think, most of them get it too. You can't blind people with science. You just have to keep it simple. So the George Mason University Center for Climate Change Communications made it simple for us by using 10 words to describe climate change. And I think this is really effective. First of all, experts agree. In fact, practically every Earth, space, and climate scientist on the planet has come to a consensus about climate change. And people can read about it if you have a Google machine. It's very easy to get the IPCC reports, the National Climate Assessment reports looking at climate impacts in the United States. Easy to understand, easy to read. They're just terrific, and there are lots of reports that are easily available. So experts agree it's real. It's not a hoax, and we know that because we have science. We have scientific instruments like thermometers, like ice cores, like geologic records, like satellites. We know that carbon dioxide has increased and decreased and has changed over tens of thousands of years. It has happened many times. Temperatures also follow those CO2 changes by rising and falling. We know that glaciers advance and we know that glaciers recede. But this particular episode of climate change we know is different. We know it's sudden, we know it's severe, and it has human fingerprints all over it. We can see with our eyes that ice is melting, that glaciers are melting, both in the northern hemisphere and the southern hemisphere. Now, we can see with our eyes and with our scientific instruments that sea levels are rising. The Yale program on climate communications, it tells us now that over 70% of the American public understands that climate change is happening now. So experts agree, it's real, and it's us. And there's no secret about it. The largest source of global warming pollution is the burning of fossil fuels. And as you can see here, things really took off after the end of the Second World War. And in this century, in the last 20 years or so, the acceleration has increased. And I would just like to say that at least partly responsible for that sudden increase in the last 20 years is due to fracked gas. Experts agree it's real, it's us, it's bad, and it's getting worse. Worldwide extreme weather catastrophes, if you turn on the news, you'll see this every day. They're on the increase, whether it's extreme weather events and hurricanes, extreme temperatures, heat waves. We've certainly had plenty of heat waves here this year, here and around the world. Droughts, wildfires, floods, mudslides. Storms are getting heavier and causing more damage. This is clearly, there are things that are changing for us. The percentage of adults in the United States who think that climate change is going to hurt future generations, 70%. Most people think it's going to hurt future generations, but when you ask them, is it going to hurt you personally, only 40% believe that it's going to hurt them personally. So that's a problem. They're sadly mistaken, and it's going to be a rude awakening for them. And I think that's where healthcare providers come in. Not by blinding people with science, but by just talking about the effects of climate change on their health. So climate change is the biggest global health threat of the 21st century. And climate affects health in many ways that are interrelated. Certainly the heat waves, the extreme weather events, but infectious diseases are on the rise, and the vectors that spread these infectious diseases are expanding their range. Food security is a problem, both quality and quantity, because of droughts, because of flooding, because of pests and disease. Food security is a big problem that we're looking at. Water quality and quantity are also threatened due to decreasing ice melt and snow melt, which billions of people rely on. Air pollution is worse as the atmosphere warms. Allergies are worse. Allergy seasons are longer. They're more severe. And finally, we heard a little bit about mental health this morning. Any human who witnesses environmental degradation and destruction is going to have a mental health impact, and that's especially true in children. Climate change is a medical emergency, and that's how we have to start talking to our patients. So who's vulnerable? Which of our patients are vulnerable? I'm a pediatrician, so pregnant women, infants, and children are always at the top of the list. And in male-dominated societies, I would say all women are at higher risk. The poor and homeless are at risk. The elderly are at risk for reasons that should be obvious to everybody. People with pre-existing medical conditions, chronic lung disease, heart disease, even chronic metabolic diseases like diabetes are at higher risk as the climate changes. People who are mentally ill, and people who labor outdoors, people who work on farms, people who work in construction, first responders who do a lot of their work outdoors, they are at higher risk. So how should doctors talk to their patients? So we can play doctor here. I can be the doctor, you can be the patient. And I would just go through each one pretty quickly, starting with heat waves. By the way, I'm having a hard time with this PowerPoint. I didn't do this on PowerPoint. Extreme heat events cause more deaths annually in the US than all other extreme weather events combined. Worldwide last year, 224 locations set all-time heat records. This January in Melbourne, Australia, 121 degrees. In Paris, in June, 115 degrees. These set records. In New York in July, 110 degrees was the heat index. Very difficult to live through a heat wave if it's just a couple of days, but heat waves are getting more severe and they're becoming longer because of the way the climate is changing and the jet streams are slowing down and getting weaker, pushing systems away. Wildfires are increasing. People say there are no more wildfire seasons in the West. All year is a wildfire season. In November, the Camp Fire killed 86 people and burned over 14,000 homes and businesses. You remember seeing that on the news. Pretty much wiped the town of Paradise, California off the map. And this summer in Beaver, Alaska, all throughout Alaska, 69 wildfires were reported burning by the end of July. That's unusual for being so close to the Arctic Circle. So, what do? You stay cool. Doctors need to ask their patients, do you have air conditioning? Do you have fans? Are you changing the filters on your air conditioner? If you don't have access in your home or apartment to air conditioning, do you have a place to go? Do you have family members that you can go to? Is there a public library or a mall that you can go to stay cool during the hottest part of the day? People should be planning their outdoor activities, obviously doing their things outside early in the morning and later at night. People should check their water supply and be reminded to drink. They should check their food supply and make sure that they're eating. They should check their other supplies as well. Do they have medications? If there's a blackout during a heat wave, that can be a disaster. People have to know that they have medications, batteries for flashlights, their cell phones charged. And finally, staying connected with family members and friends is really, really important. And you'll see that this is a recurring theme here. For extreme weather, the events are increasing. You remember Hurricane Harvey a little over 2 years ago? This is just what I'm going to show you just in the past 24 months. Hurricane Harvey came through the Gulf Coast, parked itself over Houston and stalled out, dumping huge volumes of rain over the area. And we saw pictures of, again, vulnerable people having to be rescued, having to be evacuated by first responders. Whole neighborhoods had to be evacuated, were flooded out. When these people came home, they had a lot of damage, destruction, and mold to deal with. And in fact, they're still cleaning up after those floods. The Houston area is home to oil and gas refineries, petrochemical plants, ethane crackers, plastics factories, and Superfund sites. And many of these were underwater as a result of all that raining and flooding, contaminating the floodwater. Hurricane Harvey resulted in more than 100 toxic chemical releases, mostly in lower income and minority communities. So again, affecting vulnerable people. 2 weeks later, it was Hurricane Irma's turn to barrel through the Caribbean before hitting the Florida Keys, destroying 25% of the homes and severely damaging 65% of the homes. And they're still cleaning up after Irma. 10 days later, Hurricane Maria slammed into Puerto Rico, killing more than 1,400 American citizens. In September of last year, Hurricane Florence, you remember that, a large, huge Category 4 hurricane made landfall in southern North Carolina and severely flooded the Carolinas and Virginia. And a month later, Hurricane Michael, the third strongest storm ever to hit the United States, made landfall in the panhandle of Florida, and you remember the destruction and the loss of life that occurred on the panhandle. And now we've just experienced Hurricane Dorian, which parked itself again, a Category 5, stalled out over the Bahamas, completely destroying parts of the Bahamas. Record-breaking precipitation anomalies are on the rise. These rain bombs, these very, very heavy downpours, you can see why that's called a rain bomb. They're getting more numerous and more severe. Just this summer in the Washington, D.C. area, Reagan National, almost 3.5 inches, Arlington, 4.5 inches, and Frederick, Maryland, almost 6.5 inches in just a 2-hour period. And it causes a lot of problems and a lot of danger for residents living in the area. So for extreme weather, get weather notifications. Get them sent to your iPhones, to your computers. Keep your weather stations on your TV. Keep supplies in stock, again, medicines, food, water, flashlights, and fresh batteries. Plan for extreme weather. Plan for it. Think about, what am I going to do if this happens, if there are floods in my neighborhood? Where am I going to go? What are the evacuation plans for my area? And heed evacuation warnings. When the authorities say leave, you must leave. So have that kit to take with you with all your supplies. And then again, stay connected with family and friends. Very, very important. Infectious diseases, again, they're on the rise. We worry about the vectors. The number of mosquito-borne infections increased nearly 10 times from 2004 to 2016 in the United States, and tick-borne diseases more than doubled. Pittsburgh's mosquito season is growing. In the 1980s, it was 81 days. Today, it's 111 days. Lyme disease-carrying ticks, as we've just heard, are now present in half of U.S. counties. And in Pennsylvania, every county has cases of Lyme disease, and the number of cases, as Luann showed us, are increasing. Climate change also increases the risk of waterborne diseases, and it's very important to understand that these diseases, cholera, E. coli, Campylobacter, these diseases can be severe. They're more likely to happen after extreme weather events, downpours, and flooding. So beware of ticks and mosquitoes. Use insect repellents. Don't be afraid to use DEET-containing insect repellents. They're safe. They're safe for young children as long as you're following the directions. Remove standing water around your home. It turns out that mosquitoes don't travel very far from where they hatch. And if you can remove standing water from your home and the neighbors can do the same, that will significantly decrease your risk of getting mosquito bites. Seek medical attention if symptoms of vector-borne diseases develop. Well, how do I know it's a vector-borne disease? A lot of the symptoms start out as being very vague. Fevers, low-grade fevers, aches and pains, joint pain, rashes. But if your symptoms are out of proportion to what you would expect from a mild illness, you should talk it over with your healthcare provider. And as we've seen, stay out of flood water. It can be contaminated with chemicals, but also with microorganisms that can get you sick. Air pollution is a big risk factor. Air pollution is getting worse as climate change is advancing. Worldwide, air pollution kills 9 million people prematurely every year, including tens of thousands of Americans. Particulate matter and ground-level ozone are the two most significant pollutants that will increase as the climate changes and as things warm up. Climate change will also lead to more smoke from wildfires, more dust from droughts, and allergenic mold from flooding. And all these things make people sick. We know that air pollution increases the risk of children developing high blood pressure, which can be a lifelong medical problem. We know that air pollution affects cognitive abilities and neurodevelopment in children. We know that African Americans are 3 times as likely to die from particulate matter than the rest of the population. And we also know that the percentage of African American children suffering from asthma is nearly twice that of other children in this country, of white children especially, and their death rate is 10 times higher. So we need to keep that in mind. And we also need to keep in mind that the smoke from wildfires isn't just trees. It's fuel, it's materials, it's chemicals, and people breathe this and they can have acute medical problems from it, but they can also have chronic medical problems as well. So it's important for physicians to know where their patients live, where the patients go to school, where they work. They need to know their patient's zip code and understand if their patients are living near a highway where there's diesel pollution, near a fracked well pad, or a compressor station where emissions can be significant, or other point sources of pollution or mobile sources. It's important that physicians know that. It's important to keep air pollution outdoors, sealing doors and windows, keeping windows closed. We like to open the windows at night. If you're near a point source of pollution or a mobile source, that might be the worst idea to open your windows at night because the wind stops blowing and the pollution settles, and it can settle right into your house. Keep your indoor air clean. Change your filters on your heating and cooling systems. Check daily air quality index reports. You can have them sent to your inbox if you go to airnow.gov. I think it's very important. I tell physicians and other health providers to make sure that you check those air quality forecasts as well as pollen forecasts before you leave for the office for the day. Because on days when air quality is poor, it's going to be a tough day for kids with asthma, for adults with COPD, and other health conditions. Plan your time outdoors. When air quality is poor, we probably should be indoors with air conditioning. Children really should not be allowed outside during recess if air quality is poor. In Allegheny County, air quality is poor often. So this really has resonance for those of us living in the Pittsburgh area. Children, it's probably not a good idea when air quality is poor. It's not a good idea for them to be participating in sports outside either. Keep rescue meds stocked. If you have inhalers for your COPD or asthma, make sure you have it in stock. And don't make things worse. I have neighbors who like to burn wood and open fire pits in their backyard, and it's not very neighborly. And if I'm outside, it chases me inside. It's not very fair, but it's not helpful to people in the neighborhood who have to breathe that, who may have other health conditions to deal with. Allergies are worse. The seasons are getting longer for allergies. So know your allergy season. Check your local pollen counts. Keep your allergy medicine stocked. Keep your doors and windows closed. Let's keep the pollen outside. Change your air filters. Fix leaky roofs and windows or leaky basements because mold can develop. And if you do see mold, clean it up promptly. Food security is a problem. We saw all the floods going on in the Midwest this spring, and farmers really for the whole spring and summer were unable to plant their crops. So store and refrigerate food properly. We don't want to waste any more food than we do. You know, in the United States, we waste 30 to 40% of the food we produce, which is ridiculous. We shouldn't be doing that. Wasted food goes into landfills. Landfills, as you know, release methane, which is more potent than carbon dioxide as a greenhouse gas. Buy local produce and protein. Let's save on the transportation carbon costs. Better yet, grow your own food. It'll help you eat lower on the food chain. As Michael Pollan might say, eat food, not too much, mostly plants. And ensure adequate nutrition. If you're concerned about the nutrition that you're getting, talk it over with your provider. Water is threatened, quality and quantity. Water scarcity already affects more than 40% of the world's population. And in fact, all life forms need clean water in order to survive. So know your source of drinking water. Consider filtering your water to drink. Make sure that you keep your fans running in your showers so that you're not breathing the aerosolized water, the mist. Keep an emergency supply of drinking water. I think that's important. And conserve water. If you have a leaky faucet, fix it. And finally, just a couple of words about mental health. Again, we heard a lot about this morning, but it does bear repeating. Stress is an adverse health effect. Anxiety, depression, and post-traumatic stress disorder are common reactions to stress. And really importantly, no one escapes unscathed. None of us in this room, none of us anywhere escape unscathed from the psychological trauma caused by heat waves, poor air quality, environmental degradation, destruction from extreme weather events, and the loss of property, security, health, and the loss of life itself. And if you think that adults have it tough, kids have it tougher. So assess the risks of PTSD, depression, anxiety in yourself and in those who you love. And remember to observe children closely because they don't manifest symptoms of mental illness in the same way that adults do. Don't miss doses of medications and stay cool, hydrated, fed, and connected with others. So keep it simple. Experts agree, it's real, it's us, it's bad, but the good news is there's hope. And we do already have the solutions at hand. 40 years from now, children will live in a world shaped by our choices. So are we going to choose business as usual and continue to pump greenhouse gases into the atmosphere? Are we going to choose this, sick kids who grow up to be sick adults? Are we going to give our kids a world where scientists say by the middle of this century there's going to be more plastic in the ocean by weight than fish? Are we going to stick our heads in the sand, pretend that none of this is happening, and just play through? So I think the choice is easy. I think it's simple, and this is the choice. We will leave this place an empty stone, or that shining ball of blue we can call our home. Thank you. Thanks for the opportunity. I appreciate it.
Thank you, Dr. Ketyer. Next, we have Dr. Chelsea Gridley-Smith. We're really excited to have, as Dan Barnett called him this morning, NACHO, which is the National Association of County and City Health Officials. The mission is to improve the health of communities by strengthening and advocating for local health departments. NACHO serves 3,000 local health departments. Dr. Gridley-Smith received her doctorate in biomedical sciences with a focus on biodefense and emerging infectious diseases from SUNY at Albany School of Public Health. At NACHO, she coordinates and leads the Global Climate Change Work Group and serves as lead staff on a Zika preparedness project assessing the current status of vector surveillance and control activities in the United States. Dr. Gridley-Smith.
Great. Thank you. Thank you for the introduction, and I'd also like to thank the organizers for inviting me to represent our association here at this meeting today. It's really exciting for me to see this happening at a local level and to see citizens of the community involved and engaged. Coming from a small town in Western New York, I identify a lot with what's going on in the region in terms of economics and landscape and the lifestyle choices. So I really appreciate that there's energy and momentum in this space. So today I just want to talk to you a little bit about what's going on at a national level in regards to how local health departments are engaging in the climate change space. You heard a little bit from a local example coming from Pittsburgh or the Allegheny County Health Department, which encompasses Pittsburgh. This is just going to go a little bit more broad scale. So as you heard, our mission is really to serve the 3,000 health departments across the country. We really work to advocate and strengthen these programs. NACHO itself is actually run by a board of members who are from local health departments across the country. They sort of guide our overall mission, or they direct the ship, as we say, but everyone on board our ship operates under these 4 branches here. Before I jump right into that, I just want to talk a little bit more about what local public health looks like across the country. In case you're not aware, every single state operates completely separate from every single other state, and sometimes within states, the way things are managed also varies quite drastically. As you can see by the map on your left, it's just really color-coded based on the type of governance that local health departments experience in the various states across the country. Some are purely local, some are state-led, some are a mix of both. And then the population which these health departments serve, you can see on the right hand, the lighter blue bars is the percent of local health departments, and then the darker blue is the population that's served. So you can see on the top bar, it's the number of small local health departments in this country is vast. They don't serve very much of the population because they're technically serving less than 5,000 or 50,000 folks, but still it's not irrelevant because those are a lot of folks who are our membership. And then a small minority of health departments you can see are large and serve just over half of the overall population. So in terms of how we gauge our activities and how folks are addressing the health impacts of climate change, you may imagine varies quite drastically across our geography. So you heard a little bit about what one local health department does and how NACHO organizes ourselves. We really work to assist and address the issues that locals face under these 4 buckets. Community health, you heard a little bit, is about like chronic disease, infectious disease, maternal and child health. Environmental health, which is where I lie, it's really about food safety, water preparedness, vector control, climate change. And then public health infrastructure and systems is a lot about workforce development, preparing and re-educating the current workforce and preparing new folks to enter the workforce. And public health preparedness, which you heard a little bit about this morning in sort of a roundabout way, but really what we do is we help guide local health departments who are building emergency response plans. So in any sort of emergency event, you heard a little bit about preparedness and response. Our health departments are intimately involved in preparing those exercises, running those exercises, developing the after action plans, and also creating recommendations for the community to build resilience to the emergencies. And it's actually a really nice marriage between EH and preparedness, because in climate change, we oftentimes try to link preparing for the health impacts of climate change into preparedness, because preparedness actually has a lot of infrastructure that the environmental health folks can learn from, because they're planning, they're exercising, they're evaluating, and they're responding. So what NACCHO has done on the first 2 images about the map and the bar graphs are from the data from a national assessment that we do every 3 years to try to understand more about what local health departments do so that we can make sure we're operating based on their needs. Well, we did another one similar, just looking at environmental health. So we asked in 2008 and 2012, in partnership with George Mason University, we asked environmental health directors, are you ready? Like, are you interested? Are you worried about climate change? Are you thinking about climate change? Do you feel like you're going to be affected by it? Do you feel like your services are going to be affected by it? Do you feel prepared to address any of these challenges? I'm going to show you the most recent, which is from 2012. So yes, outdated, pending funding. We'd love to do this again. At the time, 8 out of 10 health directors thought that climate change was occurring, which again at the time was a little bit more than the public. So it seemed that, and it seems to be still the trend, that health folks are seeing the impacts. They may not have the right means to communicate it always, but seems to be leading the public in terms of perception. And maybe a little bit more concerning for us and for federal partners is that 9 out of 10 of those folks didn't really feel prepared at all to address this. So when we asked these environmental health directors, what programmatic areas are you working in that are likely to be affected by climate change? These are their top 6 responses, and it really should come as no surprise based on what we've heard today. Water and foodborne diseases is right up there at the top of the list. It's up here on top because most health departments have some sort of role in food safety, whether it's restaurant inspection or something along those lines. So it's no surprise that this is the top on the list. And you also see close behind is vector-borne diseases. Okay, so those were just the programmatic areas of where our health departments work. But then we also asked them, what types of health issues do you anticipate to be affected by climate change? And these were their top 6 responses. So heat waves or heat-related illnesses was high up on that list, followed closely by overall air quality and droughts, forest fires, and brush fires. I think for me, it's interesting to think about housing for residents displaced by extreme weather is the lowest on the list. I think things have changed pretty significantly since this was released or conducted in 2012. So again, I think it'd be really nice to be able to compare how we've progressed since the first assessment, which was 2008 to 2012 to 2020-ish. Would be really nice to be able to show progression for the health field. So because we were unable to secure funding for an additional survey for that particular group, we actually wove in some climate change questions into some other NACCHO surveys that go out to our membership. So this survey was a 2018 Forces of Change. And this survey really said, okay, health departments, what are you working on? What are you worried about? What's coming up on your plate? What are you concerned about so that we would be able to help gear ourselves up for making sure we have funding to support the programmatic work that you all have coming up on the plate, which opioids was a huge example of. Now everybody is facing and dealing with the opioid crisis, which is very complex. But that was one of the reasons we wanted to do the survey, and we found out information on that. But we also found out some climate change related threats that folks were concerned about. Top on the list is vector-borne infectious diseases. Next on the list is food safety and security, sort of in alignment with what we saw of the top issues that health department folks thought they were going to be having to face more of because of climate change. I do want to make a caveat. There are more folks working in these spaces than the percentages are listed here. So we can interpret that a little bit in that just because everyone's working in vector, or a lot of people might be working in vector-borne disease or food safety and security, you saw 90-some% of our folks do that, but only 41% think that's going to be affected by climate change. We might look at that a little bit as to say maybe they're not making the connection. Maybe it's not as clear as we might have thought it is, or maybe they're just not even on board with climate change, and so it's not on the table, because we are dealing with it across the entire country. So definitely to dig into that a little bit more. So based on the surveys that we conduct and based on dealing with our members and getting feedback from the health departments, we have some main buckets of activities that we do at NACCHO to support the work of locals. We have funded demonstration sites, which I'll show you 2 of today. We developed a local health department profile report to try to understand and actually highlight some key examples from health departments. Because we work with so many, the nice thing about it is that, for example, we have a project coming up with Allegheny County Health Department. One thing we can do as a national organization is be able to take all this information from the various places across the country and kind of work with Allegheny to see, okay, you might not be LA, but LA might be doing some great things that we can translate, or San Fran or New York. There might be things that we can translate to help other programs who are working in this space. The profiles is one of those ways we do that, by highlighting what folks are doing, the objectives they have, and strategies they've taken to address the health impacts. We have a work group, which I'll show you in just a second. They have some subject matter experts across the country. We have some in sustainability offices in Austin. We've got some academic folks. We also have lots of health department folks. They serve, again, as that pulse in between those surveys. They serve as our pulse of health department folks of what they're doing. They help us develop fact sheets. They help us conduct webinars based on issues of interest. We had one on wildfires and protecting the community from polluted air because of wildfires in partnership with EPA. We put on that webinar. And there's just really a lot of energy around climate change. Folks think that because it's political that they'll get beaten down and kind of pushed to the side. These folks are extremely powerful and passionate. And they also developed and update our climate change policy statement, which again gives NACCHO the authority to take action and to sign on to some of these larger health, like Lancet countdown reports, and it gives us the authority to step out there on the ledge and support some of these initiatives. The work group, again, like I said, I'm just showing you a map of where they are across the country. We're always looking for more representation in the middle of the United States. And if there's anybody in the room or you know somebody, we'd love to have you on our work group. And really when it comes down to it, and I think the challenge that we have at NACCHO, and probably you're all seeing in some of your local spaces, is that climate change is a local issue. I understand we've talked about it today a lot in terms of glaciers and all that, but we've also heard that if you don't translate that down to what it means for you and what it means for you, it's not going to matter. I think we have too many competing priorities for us to be worried every day about the polar bears and the icebergs. But if you bring it down to the very local level of how it's going to impact your day, your week tomorrow, your summer vacation, your winter, whatever that's going to be, the local impacts is really how our locals seem to need that information to be able to take action. So I just want to highlight 2. Are we okay on time? 5 minutes? Okay. I'll give you a quick, I'll do 2 examples of what our locals are doing, for example. So this is just the compendium of success stories, so it's really just a key informant interview type of thing. We ask health departments, what are you doing in climate change? How have you addressed what impacts of climate change to health you're going to see in your community? What are your goals? What are your objectives? What are your successes? and we put them into key fact sheets. So it's got an intro and a summary takeaway, but each one of these health departments that are listed also has a front and back fact sheet, which they can take out, print out, and bring to their meetings, show to their community members, like, we're doing this is how you can engage with us. One example, yeah, I'll do this one. This one's cool. So New York City is always, it's hard sometimes, I think, for us to understand how we relate to New York City when New York City is huge, as a metropolis. But there are some interesting things that the New York City Department of Health and Mental Hygiene that they're doing to address the health impacts of climate change. I'll highlight one story from this. There's tons of resources online, but for example, and you might deal with this here, I'm not entirely sure, but so what and they've done in New York City and historically is they have had a public system where if folks do not have access to heating in the wintertime, that there are rebates that they can apply for to get subsidies for heating in the wintertime. Okay, well, they developed a similar program in the summertime for cooling. What they did is they gave if you qualify, you can get an air conditioner. Okay, great. There's no money for it. There's no money that was dedicated for the air conditioner, so people were still having increased hospital visits during these heat waves because no one was turning on the air conditioner because no one wanted to spend the money to run the air conditioner. So then you have just a mismatch between what the community needs and what we're being able to offer. So through their outreach services, they were able to see, like, wait, we had all this money going into these air conditioners, but we're still seeing tons of hospital visits because people aren't actually using them. So then they were able to go and create a really neat Be a Buddy program, while of course advocating for more funding. Be a Buddy program to, like we've heard today, build relationships. So if your neighbor knows that you're maybe in one of those vulnerable populations, to go check on you and just to build that sense of community in what looks like, and it is a huge city and we think probably is really disconnected, folks being disconnected from each other. But they're doing some really great work. And that can be translated, I think, if you take bits and pieces of it. And they've got money, so let them pilot test and bring it on over to the small ones. I'll skip San Luis Obispo County, but this one is in California. They really are focusing on communication. So I think one of the big things that we think about, and is highlighted actually in this fact sheet that the work group put together, is communicating. It's teaching folks what it means to have, what climate change means. What are the health impacts of climate change, and how to communicate that with your colleagues internally in departments and then externally among the citizens. So San Luis Obispo took on that project to educate their communities, and our work group made that as one of the top steps to build climate resilience in local health departments under categories of learn, participate and discuss, collaborate, create, and reflect. It's a 4-page fact sheet that any health department can access for free on our website that meets you where you're at. And you can pick and choose which topics that you want to work on. And it has tips for you in there, resources for you in there, and contacts for who to reach out to if you get stuck. And then I'll highlight our funding. We have this past year, we were actually able to provide 2 $10,000 grants to 2 local health departments who were engaged in climate change initiatives. One was Marquette County Health Department, and this is in Michigan. I'll talk a little bit about this one because they're pretty quick. But so Marquette County partnered with the State Department of Health and Michigan State, and they worked on this climate and health adaptation plan. And one of the things they found of vulnerability is flooding. So what the Marquette County Health Department did with our funding was they created a GIS mapping tool to target specific flood responses. Again, linking climate change into that preparedness avenue of like, okay, how have our floodplains changed? They're able to map the vulnerable populations. They're able to integrate it into the preparedness plans so that it's addressed, even if it's not specifically called out as climate change and what's causing the flooding, they're integrating it into the system. It's a really great way for this county to take a step forward. And lastly, the Boston Public Health folks, they're engaged in so many different avenues of climate change. But one of the ones that we funded them to do was to expand their Beat the Heat campaign by creating flyers in multiple translations into the four most common non-English languages that they have in Boston, which is a really a great example of how you can engage those vulnerable populations in your community to create equity. Equality and equity are also fun things, I think, for us to learn more about and the differences between them. And these are two communities that we've funded who are specifically addressing those vulnerable populations. And I'll just leave you with this. This is what I hear from our folks all the time, is we need more collaborations between health departments, academia, city departments, to all really help identify what are the local impacts to health from climate change. Those are going to be what's going to drive you forward. Those are going to be what's going to get the citizens on board. Those are going to be what your mayors are going to vote on, or whoever's in charge, is those local impacts. And then also continue to share your best practices, share your stories. In the health department, so I come from academia, and academia is very competitive, and there's not a ton of sharing unless it's published. Local health departments, completely opposite. Everything is shared. Give and take, steal, whatever it is. Do not reinvent the wheel. Do not spend time and money doing something that somebody else might have done. And so I encourage you that if you do have access to any resources and tools, or if you need some, we are great resources for you to reach out to. We can connect you with folks, and just please continue that collaborative environment, because that's really what's going to help. It's going to save money too. So with that, I'll stop and I'll thank you.
Do we have any questions for Luann or Ned or Chelsea? Any quick questions? Yes. Question is, what is the most fundamental thing that individuals can do to increase their resilience?
I might start with knowledge and awareness. I think if you don't know about, it's like confronting a problem. If you don't recognize that there might be a problem, there's no way you can even begin to think of addressing it. And we've also heard a little bit about that, the switch between fear and action is, missing the words, but empowering folks to take action by informing them and being more educated on issues, I think, is at least the very most basic step. I don't know if there's...
I mean, I have an opinion. I don't have the answer to the question. I mean, I think primarily it's maintaining their own health. But secondarily, I think that some of the lessons we learned from Hurricane Katrina and from the people who were unable to make it out or who didn't have additional medication on hand to take with them, so their blood pressure went out of control when they were huddled in the Superdome or whatever. So like keeping medications on hand and having the ability to travel and or evacuate from a situation. Not that these are all easily attainable things, particularly for vulnerable populations.
Yeah, I'm pleased to hear you say maintaining their individual health. Because I'm a forester, I'm an environmentalist, I'm a wildland firefighter, and analyst. And basically what makes an ecosystem resilient and able to respond to change is its own internal health. And when we look at all these big schemes to respond to change, we're
Any other questions? Yeah.
I do a climate change newsletter and podcast this past year or so. And so I'm on Twitter all the time and delving deep into all this stuff. I was energized this morning, but I find myself with my head in my hands this afternoon. I find myself, I do a lot of daily work researching climate sciences and keeping up with Michael Mann and Catherine Hayhoe, and even interacting with them on Twitter. But just today, this afternoon, I find myself with my head in my hands. And I just want maybe individually, if you guys could speak to that gut feeling of being overwhelmed. And I know that it's a very particular thing, but it speaks to how somebody said on Twitter the other day that taking care of yourself is climate activism too. And I think this is so fundamentally important to figure out what our diet is for how much of this stuff we take in. Because there's, you know, I did a whole issue about ticks, and it's like to hear ticks that in two different presentations was like, are these the end times, you know, that feeling of that we get? And it's like, I would like maybe to hear individually from each of you how you, when you hit that wall.
Are you asking from a local health department capacity standpoint or from a personal? Oh, personally, it's something that I've been very aware of and, you know, went into environmental health sciences, you know, in the 80s and 90s because of these concerns. So it's something that I've personally been living, and I like to believe that personally it's something that I've incorporated into my plans, although, as I mentioned, not intentionally I didn't label it climate change preparedness, but working closely with our preparedness folks at the health department who are also very similarly motivated and preparing to respond to these emergencies, realizing that I think our primary concern is really the flooding that's occurring and the resilience of the vulnerable populations, and that's just something I've, like I said, espoused for 30-some years.
And personally, I have not hit a wall yet. I'm energized by what I learn. A lot of this is, what we're talking about is communication, and there's a lot of work to do. And you know, the nice thing about the work that I do is I'm working with, you know, pretty intelligent people where we can speak the same language and you know, find common ground pretty easily. I don't let the deniers take up much space in my head. It's just a waste of time. I do also want to mention that I subscribe to having 2 outrage-free days a week, usually Wednesday and Saturday, where really I don't turn on the news. I don't really check my Facebook till later in the day. I just check my emails and respond, and do some other work writing on topics that deal with pediatrics and non-environmental health. So, you know, it's crazy watching the news. It really causes a lot of outrage, and I think that can be detrimental to our own mental health.
Maybe we can make outrage-free days Twitter hashtag trending.
Yeah. Oh, sorry.
Yeah, I don't know as though I've hit a wall. And I'm German, and I honestly feel like my heritage is we just blow through walls, and who cares about them? I wasn't quite sure in the climate change space because it was relatively new to me. I figured everyone would be very dejected. I have not met any local health department folks who are dejected about climate change. They seem to be as bullheaded as I am about it. So any more walls or red tapes that they seem to see pop up in front of them, they're not even fazed by it. They might get mad about it and say something about it, but immediately it's, well, let's move over it. Let's jump over this hurdle. Let's move on to the next and try to find ways around it. I also subscribe to this philosophy. Living in DC, as much or as little local news I can take in, the better I am. But it's staying on top of the issues and surrounding myself with the people at local health departments who have the energy. And I just am fortunate enough to be in an organization where I'm able to elevate their voices, which is an extremely powerful situation to be in, and I very much appreciate the authority that they put in me to help elevate that, so.
Okay, I think we better break. We got like a 10-minute break, so please come back at 3 o'clock. But let's give a nice round of applause. They're a wonderful panel.
Yeah, I came to school. And was that one of your first teaching jobs, or had you been? No, I came to Denver. Well, if there's first school of public health, then you didn't need. Where had you been before? At Rutgers. In New Jersey. And then but tell me about Blackwater. Is it related at all to the Blackwater Florida Park, or is it the other one? Okay. Yeah, no.
Yeah, we have an office in Thomas, which is right near the park, and we were founded about 20 years ago to found a campaign to save the Blackwater Canyon because part of it was being sold to a timber company, and we've been fighting that sale, trying to get it all moved into public ownership since 1997. It's about 2,500 acres, but it grew like topsy because we couldn't put enough pressure on it to buy it. It's not money, but some great man, wise, unique brother guy. So we decided the next best thing we could do was make his life hell if he tried to do anything degraded and wait him out. And so to do that, we started working on invasive species. We started working on air pollution, anything to build a circle of protection around the canyon and that area. And we got into this endangered species fair idea and started looking at what it takes to protect those things. And of course, they're all very temperature sensitive. Global warming is going to really wipe out their habitat completely. We're losing our ski across the country. It's already taken a tremendous hit. So the whole Highlands region, and a lot of good science because people study that. A lot of biology, botany, so for many years we've been going back, and this is a well-studied area. It's had its share of development. It wasn't ravaged though like southern West Virginia. So we got into doing climate change, and then I was a graduate of this place, and I went to Janie. I said, "Would you like to do some programs about climate change issues in the Highlands?" Because on the theory that we don't care about those things, they care about skis, they care about the ecology of the area. Yeah, I get it. Yeah. So that's what got it. So when did you start coming down?
you sticking around?
What? Oh, of course. Oh, I'm gonna miss you. I'm gonna get that.
I think that might work. You're cool with it?
All right, everybody, we're going to go ahead and get started with our last panel here. Hope you guys enjoyed your short break. I really appreciate you all sticking around. I know it's a long day to sit, but I hope you guys have learned something today and enjoyed yourself. And hopefully we can keep these conferences going and bring you guys back here and keep the momentum going. So with that, I will briefly introduce our first presenter, which is Shana. I didn't know. I got to that point in the sentence and I was like, oh, I didn't ask who was presenting first. Shana Udvardy is a climate resilience analyst with the Climate and Energy Program at the Union of Concerned Scientists. She conducts research and policy analysis to help inform and build support to increase resilience to climate change impacts with UCS. She holds a bachelor's from Syracuse University and a master's in conservation, ecology, and sustainable development from the University of Georgia. I won't take up any more valuable time, so with that, Shana?
Well, thanks everybody for sticking around. I'm really excited to be here and be part of this great conversation. I am representing my team today to present our latest analysis called Killer Heat in the United States. I first wanted just to tell you a little bit about the Union of Concerned Scientists. We have over 500 members and supporters and 26,000 scientists in our science network, and we are doing our own vigorous technical analysis to help ensure a healthier planet and a safer world. We've been around for 50 years, so we couldn't have done this without our supporters and members and scientific network, and so we really appreciate all of the folks that have helped make all of the good work that we do happen. And members actually fund about 70% of our organization, so we really appreciate them. So the two critical climate change reports came out recently, both the International Panel on Climate Change, the 1.5 degrees Celsius report, as well as the fourth National Climate Assessment Report. And both of these reports are telling us that global warming is here and now, and climate change is here and now. And it's telling us that humans are responsible for the emissions and that that's what's causing global warming. So what's going on? We are living in a 1 degree Celsius world. And what does that mean? Well, you heard today about all of the different impacts of what living in a 1.8 degrees Fahrenheit world actually means. But when it comes to heat, what does that look like? Well, we also heard today the statistic that 18 of the 19 hottest years on record since record keeping began happened in the last 17 years. So what does that mean? That means that kids that are graduating high school today have only known these record-breaking heat years. It also means that a lot of the places and people are going to be impacted by this heat. We heard also that about the elderly, the young, women, particularly pregnant women, are going to be particularly affected by extreme heat. And of course, people who already have pre-existing conditions like asthma. But also in urban areas, we know the heat island effect. We all know, I think, what that is, but basically the asphalt and the roofs hold heat longer, and it takes a longer time for those apartments and buildings to cool off. And so that's the heat island effect. I wanted to talk a little bit more about the IPCC report, but one of the things it talks about is the loss of habitat for our different species across the spectrum of different species and habitat. I wanted to focus in on coral reefs because we heard about that earlier this morning, and we know that coral reefs are one of the most biodiverse habitats that we have, and that fisheries, very important to fisheries and other types of species, but are particularly impacted by warming waters. And so this is what it looks like when we have coral bleaching. And what the IPCC report finds is that under a 1.5 degrees Celsius world, we'll lose about 70 to 90% of our coral reefs. And at a 2 degrees Celsius world, we'll lose pretty much 99% of the coral reef species. And that's unfortunately with a very high confidence. So where are we going? I mentioned we hit the 1.8 degrees Fahrenheit mark in 2017, and we are certainly on, unfortunately, the business as usual pathway as far as the carbon emissions goes. And so we're going to hit most likely the 1.5 degrees Celsius mark in 2040, and on the same pathway we will reach a 2 degrees Celsius mark by 2060. You saw this, an image just like this earlier, but I kept this in the presentation because what it's showing you is how we can get to these different scenarios, so how we can limit the amount of warming. And you start up on the top and move down. You can see the baseline, the sort of worst case scenario, what we're on now. We'll warm the planet by almost 5 degrees Celsius. But if we go all the way down to the bottom, we can look at some of the pledges that we currently have through the Paris Agreement and through what cities and states are already doing. And that can get us at the end of the century to just a little bit above 2.5 degrees Celsius, between 2.5 and a little over 3 degrees Celsius. And then if we want to be even more aggressive, we can get the warming down to 1.5 and maybe even below 1.5. But as you can see, it's going to take immediate and aggressive action today or yesterday. So this is our killer heat report. I'm going to jump right into this. We did this analysis because we really, like our sea level rise analysis that we put a lot of time into, we really wanted to give people an idea of what they're going to see in the future in a way that they can actually take action, both in preparing and then for cities and governments to help reduce the emissions. We looked at temperature and humidity, or the heat index. We also used about 18 high-resolution climate models to get this data, and we looked at 3 emission scenarios that I'll show you in a little bit. And we have data that's available for every single community in the lower 48. So what has it been like, and where we are with heat? Well, we all know, we've been paying attention, right? We've seen that heat waves are becoming more frequent over the years. We also have seen that they're becoming more intense. And we know that the length of the heat season is also increasing. So we really do have a challenge in our hands. I don't know if any of you saw the latest NOAA outlook, but the outlook came out for the fall, and it doesn't look good for heat. This is the outlook for the next 3 months. And you can see Alaska there up at the top is pretty much baking. And I look throughout all of the different outlooks from now and into 2020, and unfortunately, Alaska is going to be hot throughout the year and through into 2020. This is actually the NOAA outlook for 2020. It was for a 3-month outlook for 2020, and it's even looking worse than this fall outlook. So we know, we've heard about some of the impacts of heat. We know that we've been seeing a lot more of emergency, people getting entered into emergency rooms and really getting impacted by heat waves. We actually put this report out during July, so that was when we had that extensive heat wave. And we're seeing that people are really getting impacted and having heat illnesses. So just getting into a little bit about how we did this how we did this science and this analysis. As I mentioned, we focused in on the heat index, and you all know what that is, but it's the temperature and the humidity. And the reason why we focused in on that, because that's what they call the feels like temperature, right? And so wanted to just give an example here. So that's, for example, if we have a 90-degree day, and if the humidity is at 60%, then that's going to be a feels like temperature of 100. So that's the heat index. And so we looked at that, and what we found is in this black area is what we're calling off the charts. And what we mean by off the charts is basically the National Weather Service put together a heat index based on what we thought we knew about what we can expect on what we've seen on the planet as far as heat. And so what we found with doing this analysis is that the formulas that the National Weather Service did to create a heat index no longer apply after we get above a certain amount. And so what we're calling this is off the charts, undetermined heat index. So I want to walk you through some of the results, but first a little bit more on the methodology. We focused in on 4 different thresholds of of heat index. And we did that because we wanted to get at kind of where people are most impacted. So people can get maybe some heat illnesses after 80 degrees, a heat index of 80 degrees. But we're seeing these different columns here. So the yellow column is looking at 90 degrees threshold or above. And that's when people that I mentioned earlier, elderly, the young, particularly pregnant women, et cetera, are going to get particularly irritated and have some issues with extreme heat. In the orange is a threshold of a heat index above 100 degrees. And that's when people, I'm sorry, I got that wrong. The yellow is outdoor workers, so that's 90 degrees. That's when outdoor workers, construction workers, farmers, those kinds of folks are going to have a particularly hard time. At the 100 degrees heat index, that's when the elderly are going to have an issue and others. And then at above 105 heat index, that's when anyone, if you're exerting yourself at all, that's when you're going to start feeling it and have a risk of heat illnesses. And then, as I mentioned, the undetermined and off the charts is what I just explained. So these are the different scenarios we use based on the fourth National Climate Assessment. And you can see the no action, or sort of basically kind of what the pathway we're on now. At the end of the century, we'd get to just under 8 degrees Fahrenheit. And then we also looked at sort of a slow action scenario, which would get us at the end of the century to about 4.3 degrees Fahrenheit. And then we also looked at a rapid action that would get us to hopefully where we'll go as, at the end of the century to under just about 3.6 degrees Fahrenheit. So jumping into the results, we looked at, as I mentioned, the lower 48. This is looking at the heat index for 100 degrees across the United States and at mid-century. So within the next 15 to 40 years, what we can expect on average. And so the colors that you're seeing here, from yellow to dark red, are the increase in the numbers of days that we're going to see these extreme heat days. And this is looking at just the heat index for 100 degrees. And as I mentioned, that's when the elderly and pregnant women and children or so on are going to be particularly impacted. And so what we see here is that by mid-century, we're going to see that these number of heat days, extreme heat days, are going to double. And just jumping into the 105 heat index, what we're going to see is that by the mid-century, with no action, so this is the worst case scenario, we will see a quadrupling of these extreme heat days. We looked at cities, and what this map is showing is basically the number of cities that would see what we thought was a particularly bad threshold of 30 days or more of a heat index above 105 degrees. And so what we found is that 150 cities by mid-century under no action scenario would see these types of heat index conditions, 30 days with 105 degrees or more heat index. And that would be 92 million people that are impacted. Today, the number of people that are seeing this type of heat conditions are about 1 million. So that would increase to 91 million. We also know that some types of communities are particularly impacted by heat and extreme heat. And Latin American communities as well as African American communities are particularly impacted. And this is just showing, and it's probably not too much of a surprise, but this is generally where we're seeing high concentrations of the African American populations. And this is looking at late century. And so late century, we found that 105 degree in heat index will become 8 times as more likely under a no action scenario. And then I just wanted to run in, just talk about a little bit about the findings on the off the charts conditions. So this is late century. What we found is that historically, we've only seen this type of off the charts type of heat index in the lower California, Arizona area, basically the Sonoran Desert. But by the late century, we're going to see that 60% or more of the United States by area will experience these types of conditions 1 time or more per year. And this means 120 million people would experience 7 or more days of off-the-charts heat on average, compared to about 2,000 2,000 or less today. So that's really a daunting statistic there. But there's good news. So I know we heard a lot of bad news today. This was really sobering. But we did do some analysis to say, well, what if we keep to the low emissions scenario? What if we keep to that sort of, aggressive action on emissions reduction? What will it look like at the end of the century? And how much can we spare how many cities and people can we spare these types of conditions? And so what we found is that, again, this is looking at the cities, heat index of 105 degrees. And what we found is that we can spare, it's going from, I believe it was 190 to 85, or 290 cities to 85 cities. So that's really a huge amount of cities that will be spared this type of heat index if we do take this aggressive action. So that's, I think, good news. So the takeaways are, first, failing to take actions to reduce emissions would lead to a staggering expansion of disastrous heat. And so aggressively reducing emissions could contain this expansion. So the time to act is now. So we were sort of asked to think differently about how we talk about adaptation and mitigation, and so I'll try to do that. But in the policy world, we do talk about the need for adaptation and mitigation. And adaptation, we're really talking about being prepared. How are we going to do that? So to move forward, the solutions are about both. How do we be prepared and how do we reduce the problems? So I want to talk about a few of the different policy pieces that the Union of Concerned Scientists is advocating. We don't have time to go through all of them. But one is really hopeful and positive to see this bill be introduced and have a growing number of co-sponsors. It's the National Occupational it would provide National Occupational Safety Standards, or OSHA standards, for indoor and outdoor heat. And it's called HR 3668. It's the Asuncion Valdivia Heat Illness and Fatality Act of 2019. This bill came about because it was about this gentleman who was picking grapes in California for 10 hours straight under extreme heat conditions, wanted to get a break to cool off, wasn't allowed to get a break, and unfortunately his son called his son, and his son wasn't able to get him to the emergency room fast enough, and he died. But we've heard many, many different stories like this, unfortunately. And so what this bill would do is help make sure we have those standards in place. And so we are supporting this. We just had a briefing on the Hill this past week, and we're able to give it a little more attention. We also need to do the transitioning away from these high emission fossil fuel sectors. The highest sector is the power sector, followed by transportation, and then many others. So there's a lot of work we need to do to get to a clean energy economy. And one is through increasing renewables, and we can do that, and that can provide jobs. And of course, we can transition to cleaner vehicle fleet as well. So what we're promoting, and it's just one of many policies, is a renewable energy standard. And there are a few different bills out there, but basically what a standard like this would do is help provide incentives, monetary incentives, to push renewables out a lot faster. So basically, a renewable energy standard would help increase renewable electricity from 18% that we had in 2018 to about 50% in 2035. This would nearly eliminate coal, and it would reduce gas by 38%. And the great news about it is that, and we need to tell President Trump, that it'll actually save about $34 billion in savings to consumers. So it's really a win-win, as you all can understand. We have a lot of resources on our website, so I just wanted to run through those now. One is this widget where you can put in your zip code and the temperature that you're most concerned about, and it will give you some data. And we also have this ESRI GIS mapping tool. So you can go to your community and take a look at what is this going to look like at those different temperature thresholds, heat index thresholds, and into the future, and how much you can be spared, the number of heat index days you can be spared if we do action. So all of that is available on our website. But we also have congressional district fact sheets. So I really hope you guys go take a look. And when you go to, this is the mapping tool, you can put in your town or community and it'll pop up and it'll give you a link to this fact sheet. So what this fact sheet does, it's two-sided. one piece of paper. It basically goes through each of those different thresholds, those heat index thresholds, the number of days you're going to see in those different time steps, those different scenarios. And then the last column is the number of heat index days you're going to be spared if we keep emissions down. So you can take this to your member of Congress, and I don't know if there are that many students left here, but that's kind of one of the messages to them is, because a lot of you probably already know this, but reach out through social media. You can get the message across. You can follow your members of Congress on Facebook or Twitter, and you can go to some of their forums and meetings and talk to them about how we can reduce our emissions. And writing a letter to the editor is actually a really easy thing or can be a really powerful way of getting your messages across. So this is a sign that one of the kids in Boston made, and my colleague took a picture of it. And I thought this would be a really nice way to end the presentation, to end it on a little bit of hope, bring in that spirit from the climate strike and all the youth. So I think we can do this. We can help get the emissions down and have a cooler climate, I hope. So thank you very much. I don't know where your presentation is.
All right, thank you, Shana. Our final presenter of the day, no pressure, is Dr. Ashley Ward. She is the Senior Policy Associate for Engagement and Outreach at the Duke University Nicholas School for Policy Solutions, or I think Nicholas Institute for Policy Solutions. Her career has focused on engaging communities to identify and address their issues, and helping communities develop long-term sustainable strategies relevant to their particular needs. She holds a Ph.D. in geography from the University of North Carolina in Chapel Hill. How does that work? Any sports fans will understand. And with that, I will now bring up Dr. Ashley Ward.
Oh yeah, people frequently ask me how I move between the two. We're all friendly. Okay, I'm gonna try and. Okay, so thank you for having me. It's a joy to come and talk with all of you about the work, about this work in the Carolinas. And so my training is in medical and health geography. And so a lot of people, when I say that, they kind of don't really know what to say. But what I'm here to tell you is basically particularly when it comes to climate health interactions, is that place matters. And a lot of what I'm going to talk to you about today is actually the power of place-based study and community engagement when we talk about climate health interactions, and how, for me, it is my opinion and what I've witnessed and seen personally that this is a really powerful way to move the ball forward. And one of the questions earlier was about how do people keep from getting, just inundated and depressed, basically, with all of this, all of us who are working in climate science. And I really think that I haven't hit that wall, and the reason I haven't hit that wall is because I'm constantly surrounded with these incredible people that I work with in these communities. If you really want to see innovation and resilience, then you go to some of these communities, because this is where the greatest work is. And so I want to share that a little bit with you today. And through a few examples of our work in the Carolinas, one is on the foundational heat work that really illuminated some patterns with heat-related illness that surprised us all, quite frankly. And then that also moved us towards some work regarding heat-related illness in maternal health and student athletes. So I'm going to talk to you a little bit about that. This work actually came out of, I just recently moved to Duke. Previous, I worked with the NOAA RESA program. RESA stands for Regional Integrated Sciences and Assessment. The RESA program is a wonderful program that situates 11 research teams across the country. Each of us are geographically situated, and I was situated in the one in the Carolinas. And our purpose is to work with communities to help them build resilience to and develop adaptive strategies toward extreme climate events. So CISA, which is the Carolinas RESA, Carolinas Integrated Sciences and Assessment, is who I worked with. And our focus areas were climate and water, coastal climate, climate and public health, and climate communications and outreach. And I fell within the two, climate and public health and climate communications and outreach. And really, all of this work began with a dissertation topic. Maggie Kovac at the time, who's now Maggie Sugg, she's a professor now at Appalachian State University, wrote about her dissertation on heat-related illness rates in North Carolina. She used the NC Detect system, which is an epidemiological syndromic surveillance system available in North Carolina that gives us every emergency department visit in the state, with the exception of the military hospital and the Native American hospital. So it's a pretty thorough and wonderful data set, but it is limited to emergency department visits. And she mapped the heat illness rates by zip code, and the result of which you can see here. Now, to give you a little bit of geography of North Carolina, the Piedmont and those black dots that you see at the top, that's the urban arc of Winston-Salem, Greensboro, Raleigh, Durham, Chapel Hill. And the black dots toward the bottom, west of the Piedmont, that's Charlotte. Those are our big urban areas. You have Asheville over in the mountains and a few smaller cities in the coastal plain. And so I'm going to go to this next slide, and I'm going to go back and forth. Hopefully I don't make any of you dizzy. But some of the really compelling results of this study. First, we noticed that there were more emergency department visits in what we call abnormally hot days, between 90 degrees and 95 degrees, and not the exceptionally hot days that exceed 100 degrees. Now, what could this mean? Okay, so it could mean that when it gets really hot, people are listening to the National Weather Service warnings and they're doing what they're supposed to do, and that's fantastic. It could also mean, though, that in that 90 to 95 degrees, that even though it is dangerously hot, particularly for some populations, people are still working outside, they're still working on the farm, they're still practicing their sport, and so on and so forth. And so emergency department visits actually spiked higher, I think it was around 93 degrees, than it was at the 100-degree mark. And so this was a really interesting finding for us. Perhaps more interesting was the rural to urban disparity, and I want to go back to this map really quickly. I don't know if you can read these numbers here, but if you see the bottom number for heat-related illness rates, these areas in the tan and the red are all rural areas in North Carolina, with heat illness rates about 8 to 10 times what we see in urban spaces in North Carolina. Now, when you think about what you know about heat-related illness, the traditional story about heat-related illness focuses heavily on the urban heat island, rightfully so, right, and the vulnerability of urban populations. So this was a very interesting finding. And in fact, it has been, this same result over and over again with different populations in North Carolina. We see the same geography. So imagine had our public health officials created an entire prevention strategy based upon the national narrative around heat illness. They likely would have missed a very important mark, and that is really invulnerable populations here in what we call the Sand Hills. This is where sort of Fayetteville is, Lumberton, North Carolina is, for those of you who are curious. So this was a really incredible finding, and what I think illuminates the power of smaller scale research around the climate health interactions that we see. Definitely it is absolutely important, particularly for policy, as we just saw in the previous talk with Shana, that we have these types of large-scale studies that are conducted. But when it comes to public health prevention programs in your local community, it is important that you understand what's going on in your community. And know you're better at that than any of us anywhere else. The other really surprising element was the most vulnerable group, and in fact 75% of emergency department visits in North Carolina has remained so, are men 18 to 44. This is also not the typical risk group. The typical risk group are children, elderly, and people with chronic illness. Those people are all at risk, but it just so happens in North Carolina, what we see is that males from 18 to 44 are highest at risk. And these red areas that you see in North Carolina, these are big farming communities. Another interesting fact about North Carolina, and my guess is would be throughout the Southeast, one thing that happened in the Southeast that was different from what we see in the Northeast is when manufacturing moved to the Southeast, manufacturing did not place itself in urban centers. Manufacturing moved to rural areas in the Southeast. We have our biggest manufacturers all in the coastal plain in North Carolina, right? And I did an engagement with occupational health nurses actually just north of that reddest spot, and learned that for many of them, they logged indoor temperatures at 100 degrees during the summer. So think about this. You're at work all day. It's in the 90s or maybe worse, 100 degrees in your factory. You go home. These areas that you see have the highest mobile home ownership rates, the highest poverty rates, and the highest energy poverty rates in the state. You go home from work to a house that's not energy efficient, whether you have one window unit, a central air conditioning unit, if you can afford to run it. There's no time for the body to recover from the prolonged heat exposure of the day. Whether you're an agricultural worker, a student athlete, or a manufacturing worker. And so we really believe this is what's happening in North Carolina, and some of the work is expanding outside of North Carolina to the broader Southeast, and I believe we're going to see some of the same patterns. And then finally, another interesting finding from this was the peak. Many times we hear about the period of acclimation for folks when it comes to heat illness. Like if there's a heat wave that comes early in the heat season, people haven't yet acclimated to the heat, so we see spikes nationwide in May sometimes. That's actually not what was happening in North Carolina. It was spiking in the midsummer in North Carolina. So there were so many findings with this report, and we were so baffled by this that we partnered with the North Carolina CDC BRACE. How many of you have heard of the BRACE program? It's Building Resilience Against Climate Extremes. There are, I think, 7 BRACE states. If someone knows, you should correct me because I'm not really sure, but North Carolina is one of them. And so we partnered with the North Carolina BRACE, with the North Carolina Division of Public Health, and conducted a series of engagements all around those 7 counties in that reddest area that you saw. And this was probably the best decision we could have made, right? Because we heard so much. We had folks from agricultural extension, athletic trainers, occupational health folks, we had migrant health folks, public health, emergency management and planning, broad group of folks sitting at the table around during these engagements. And one of the questions we asked them is, who do you think is most vulnerable in your community? And we did get a lot of the usual suspects, right? Although they all said exactly what, without even knowing the research. We didn't tell them the research first, but they all said young men, outdoor workers, manufacturing workers. So their experience actually reflected, her research actually reflected their experience, which I thought was really great to see. But one group kept coming up, pregnant women, over and over. And I mean, maybe all but one community engagement, somebody would say, pregnant women, pregnant women. Okay, so maybe I need to check into this because pregnant women hadn't made it on our radar. And I started to look, and there was not a single study in the Southeast that looked at the impact on pregnant women of heat. And you saw from the earlier maps that the Southeast is one of the places where exposure is projected to be the highest, and we also have some of the worst maternal health outcomes in the country. Many of the top 10 of preterm labor rates are all in the Southeast. And so we decided to do a little bit more digging. In North Carolina, the typical preterm birth risk is associated with a history of preterm birth, a woman who has already had a birth that was preterm, someone giving multiple births, smoking, alcohol or drug use, late or no prenatal care, diabetes or hypertension or other chronic illnesses or some kind of infection. When we look at the heat work around pregnant women, there's actually been quite a bit of work done globally on this topic, particularly Australia, Canada, Germany, and the UK. They've done a great job. And a little bit of work in the western part of the US, and particularly Pacific Northwest. And I think Chicago has a pretty good study. Boston, I think, has one too. Most of these studies focus on a single heat wave event. We had a heat wave event, and we want to see what happened during the single heat wave event. They usually examined all temperature extremes, extreme cold as well as extreme heat. And like I said before, they're very geographically focused in certain areas. And they do find, in fact, that heat waves do, in fact, have a negative impact on pregnant women. And the magnitude of this impact is really based upon the strength and the length of exposure. And these impacts range, anywhere from 1 to 2% increase in risk given every temperature unit. Most of the time they're looking at a 5-degree increase in heat index, which is what's most common that was used. For every 5-degree increase in heat index, a woman's risk for preterm birth increases 1 or 2%, right? So we decided we would look at a variety of meteorological variables, and you can see them listed here, to try and see if they had played a role in preterm birth in North Carolina, and if so, what was the magnitude of that role. And then we also wanted to develop thresholds. And I'll talk a little bit about both of these, but I'm not going to spend a lot of time talking about the study. I do include some stuff in my slides here so that you all can have it, and I also include the reference to the article that was just published a couple of months ago so that you can refer to it if you need to. We did look at all singleton live births in North Carolina from a period of 2011 to 2015 using birth certificate data in North Carolina. Starting in 2011, this is really important for those of you interested in birth certificate data, although most of the students are gone. At that point at 2011, we had obstetrician estimated gestational period, which is a really important factor when you're looking at preterm birth on birth certificates. Other than it's based on last cycle, it's a little bit less accurate, but that's why we chose those study years. So we looked at that birth certificate data. We used PRISM data, which for those of you who are not familiar with is a nice, wonderful gridded data set, 4 kilometer by 4 kilometer. This is wonderful because we can average these temperatures across a county, clip it at the county boundaries. This is much more accurate than a single weather station measurement. And so we used PRISM data, and then we also looked at a variety of other things, maternal age, race, ethnicity, so on and so forth. We used a case crossover study design and have a few descriptive statistics and use GAM models to set our thresholds. Again, this is all for you for a little bit later. I'm kind of zooming through this. We do have some general patterns in preterm birth in North Carolina, which I suspect most anywhere you would see definite patterns. At each end of the age spectrum, women are much more likely to have preterm birth. Minority women, more likely to go into to have preterm birth. And women on Medicaid or low socioeconomic status, more likely to have preterm birth. That's not a big surprise. Okay, so what were our results? A few surprising ones. We divided the state by the mountain, Piedmont, and coastal divide that you saw on the earlier map. And most notably, in the eastern part of the state where we had the high, we look at the green arrow. This first column that says threshold, we found that minimum temperatures had the most correlation with preterm birth. Now, this is an important finding because when we talk about actually climate change or warming, one of the things that we really are talking about is sustainable high overnight temperatures, high minimum temperatures. This is really one of the drivers of global climate change. So, what we're seeing here is a minimum temperature of 75 degrees to 76 degrees. I'm in the eastern with the green arrow. Equates to about a 4% increase in risk of preterm birth. What's really interesting is that falls in the 90 to 92 percentile of minimum temperatures in that region. You can see a slightly less impact in the Piedmont. In the mountains, actually quite significant, a 6% at this same threshold. Now, there's a few things I want to just pull out of this for you. The biggest for me is we're seeing the most significant impacts to pregnant women at the 90th percentile mark. National Weather Service warnings go out at 95 and 98 percentile. So what we're seeing is that people are in fact vulnerable to heat-related illness, and pregnant women are particularly vulnerable at temperatures long before the National Weather Service issues a heat warning. Now, the reason this is important is for public health concerns, right? I'm not advocating for more warnings. I should be very clear about that. Warning fatigue is a real thing. For those of you who are in the Southeast, we get thunderstorm warnings every single day, and nobody pays any attention to them, and actually can be quite serious. So we don't want to do that, right? But what we do want to do is inform physicians so they know that when we have forecasted weather, that puts their patients at risk. They can put out information. They can warn the patients they see. Occupational health nurses who were working with folks before they leave. The best advice, one of the occupational health nurses, she started noticing a lot of heat illness in her factory. And so she started telling everyone, because she knew that a lot of the population couldn't afford to run their air condition, to leave work, go home and take a cold shower and sit in front of a fan. Now, this doesn't cost them any money. And they did it, and they feel better when they do it. So this is a way of lowering their core body temperature. These are the people who are on the front lines. These are the people who are going to reduce health risk and poor health outcomes, right? She's talking to people who are working with her. She can see the National Weather Service forecast, know she has someone pregnant in her factory, and give them good advice immediately. Midwives, obstetricians. This is why this work is important. So we can inform folks who are constantly in contact with these at-risk populations so they know where the thresholds are so they can warn their population. A little bit of a switch. In the same meetings, in those same meetings that pulled out highlighted for us pregnant women, one of the things that kept coming up is, I would really love to be able to reduce heat illness among young student athletes in the state, but we have no idea, how to plan for this. I'm a football coach, and I think I'm going to wear pads on Wednesday at practice, but then Wednesday comes around, and it's too hot, and now we don't know what to do. Now, this work that I'm about to tell you about actually has been going on. I'm more peripherally involved in this work, but I think all of you would be interested in it, so I decided to include it. So my colleagues at the Southeastern Regional Climate Center and CISA are working with the North Carolina Athletic Association and developing a forecasting tool. They're using wet bulb globe temperature, and I'll tell you more about that in just a moment. And one of the first things they did was they mapped emergency department visits, much like what I showed you earlier at the zip code level, but this time at the county level. And we see some similar patterns, right, that we saw with that earlier map. A little bit more risk in the northeastern part of the state than we normally would have expected. And then when we look at emergency department visits, and this is 14 to 17, we definitely see that spike in August. August 1st is the beginning of practice season in North Carolina. I'm not sure if it is here too. But we definitely see, the summer months, but then that very definite spike in August. And so for the most part, and I'm not sure what West Virginia uses, but most of the statewide athletic associations use wet bulb globe as an indicator of heat risk for student athletes. And in fact, they dictate their policies on practice based on the wet bulb globe temperature. How many of you are familiar with wet bulb globe? Okay, I didn't want to explain it if everyone in the room knew it, so I think I'll just give a quick introduction. But basically, the power of the wet bulb globe is that it includes several components: the dry bulb temperature, which is basically your basic air temperature, the natural wet bulb, and the globe temperature. This is important because they combine not only humidity, as Shana was talking about a moment ago, which is very important, but also wind speed and solar radiation. Now, as a student athlete, the reason this is important is because when the humidity is high and you sweat, there's so much moisture in the air, there's nowhere for it to go. It's not evaporated. So that evaporative cooling that is the body's normal function to lower your core body temperature isn't happening. However, if it's windy outside, the wind is actually cooling off that sweat from your skin, and it's actually mimicking that evaporative cooling. So it can actually lower your risk. So incorporating all these components into a temperature variable is what they've used most frequently to determine risk. OSHA uses this. There's an indoor wet bulb globe, and this is what OSHA requires for occupational heat as well. So using the wet bulb globe, they've developed a forecasting tool, and I took a screenshot of it here. You can visit it at the website below. But the forecasting tool enables an athletic trainer or coach to look hour by hour. The flags that you see at the top, and I'll show you the code for those, these are based on the North Carolina Athletic Association. Your flags in your state would be likely slightly different. But it can tell you what warning level you're at a certain time. So now a coach can say, okay, Wednesday in this scenario is actually supposed to be pretty cool, but maybe Monday is supposed to be not so great. So let's do a light practice on Monday, and we'll do pads and full gear on Wednesday. And so these kinds of tools and these types of thresholds and research all developed out of the community connection and community-based research, which is why I think that is so powerful, right? It illuminates questions for us that we didn't know, and it gives us great innovative ideas about how to address the problems. Here is what those flags mean. And this is Chip Conrad is the director of the Southeast Regional Climate Center. He's the lead of this project on the Wet Bowl Globe. And Jordan Clark is the graduate student who's working on this project. If you have any interest in this project, I highly recommend you reach out to them. Right now, this year, they're piloting in North Carolina. Next year, it will go southeast wide. And you can put your address in the map, and it will pull up your Wet Bowl Globe forecast for you. Okay, just a final little word quickly about trends. So when we did the heat pregnancy work, we decided, okay, let's look at that minimum temperature threshold for pregnant women in the eastern part of the state who are so vulnerable, and let's see how that's changed. And this is how that's changed over the last 75 years. And so in 2017, which is the last line over here, what we're seeing is that's a very dramatic positive trend. What we're seeing is in excess of 25 days above that threshold where women are highest at risk for preterm birth and likely to get worse, as you just saw in the previous presentation. And so, thinking about how we deal with these changing environments, in particular with the communities that we're working with, is a critical issue. And so overall, I hope what I've done for you today is highlight the need for place-based studies regarding the impacts of heat on human health. Exposure can be mapped and quite well, right? But vulnerability to heat illness depends on a variety of factors that are sometimes hidden when we look at things from a larger scale, right? And so it's great if you're able to get into your communities, to talk to community members who are working with the public in that community and try and think about what these variables are that actually impact their vulnerability to heat. I also want to acknowledge CISA and the Southeast Regional Climate Center, where I did all this work, and my collaborators and co-authors that you see here. I've also put for you the references of the two articles. This first one is the article on the preterm birth that you can find, and the second one is the original one with the map on heat-related illness at the zip code level in North Carolina. So thank you.
All right, questions for Shana or Ashley? I think we've foregone the note cards, so I'll just give a microphone out here.
I appreciate your talk. So I'm coming at this from an engineering perspective. I'd be interested in you elaborating on this a little bit. But as an engineer, we look at the number of temperature degree days that we have to heat and cool a space to be able to maintain that comfort. And so the United States is designed around climate zones, which translate into the natural world as well, growing seasons and such. When I started my practice, we were in climate zone 5. That's been a couple years ago, but you're probably aware that we're now in climate zone 4. And the trajectory is for Parkersburg, West Virginia, which is where I currently live and work, at a 2.5 degree 2100, we're projected to be in climate zone 3. And a 4.5 at 2100 would put us into a climate zone 2. And that is Atlanta is currently in climate zone 2. So I'm interested in it. Is that generally scale with, are you familiar with this research? And that's pretty much in alignment with what you're seeing and trending.
It doesn't matter. You can go first. Or
I'm actually not a heat expert. I'm a certified floodplain manager, done a lot of the work on the sea level rise analysis and stuff. But yes, I think I'm familiar with the study you're speaking about. It was a journal article that looked at what cities would look like, or what their twin city would be like in the future, kind of thing. But yeah, I think that's where the data is indicating that we are changing the climate, and we're seeing that in a lot of different aspects. So yeah.
I think too, we've heard this in a few of the other talks today, and one of the things that you may be touching on too is the economic impact of these shifts, and it's going to be substantial, right? There are folks who have rarely ever run their air conditioning who are already having to run it occasionally, but now we're going to talk about having to run their air conditioning for much of the summer. As you saw in Shana's earlier presentation and in the trend line that I showed, you know, I think it was 50 days or more in North Carolina in some places of these extreme heat days that are coming. And right now we're at the 25, you know, as I showed you. And in some cases 30, depending on the year. This past year was particularly bad, right? Mm-hmm. And the burden on communities, particularly communities who, like I described earlier, live in inefficient housing or cannot afford to run their air conditioning. I had a guy who was actually a cucumber picker in North Carolina tell me in one of our engagements that it's hotter inside of his house when he goes home than it is outside of his house. So he spends most of his evenings sitting outside. So what do we do about this, right? There are some programs. In North Carolina, there was a fan program, and that advice from that occupational nurse to go home, take a cool shower, and sit in front of a fan, she's telling him exactly the right thing to do, right? Right now, that program is limited through I think it's the Center for Medicare, it's the Center for Aging program in North Carolina, so it's only given to 65 and older. But in fact, it would be wonderful if our state would expand that program, right, to include all who qualify for something like that, which would reduce the burden. There's been quite a bit of back and forth. I was actually at the GIN, which is the Global Heat Health Information Network meeting in Hong Kong at the end of last year, and the folks in Australia have done quite a bit of work looking at whether or not fans are actually as effective as running your air conditioning some, and there's quite a bit of debate back and forth in the literature that I don't think yet is settled, but it certainly does seem to point to the fact that proper use of fans employed in particular cases are actually quite effective.
You know, just as an engineer, you'll appreciate the fact that, you know, you can imagine with these extreme heat days, how much it's going to take to, you know, actually, how much energy it's going to take to actually handle the AC. And so we're going to see these conditions where, you know, some of the systems just won't be able to handle the extreme heat and the surge on the energy system. And so that's another reason to be thinking about how to be more efficient with the energy we use, but also how to be, have more resilient types of energy systems like microgrids that can be tend to be smaller and more resilient particularly to storms and extreme weather.
And some of the renewable energy sources
And the
that would
renewable
help
energy,
back
yeah.
up, yeah.
Well, we're gonna have to create more energy and we're gonna have to do it more efficiently, so it's a double whammy that, you know, the engineering community has gotta try to get around here.
Mm-hmm.
Other questions?
Ashley, this really interesting data. Did you look at all at air pollution? Some of the earlier data particularly on high school athletes were
Right.
out of ozone studies in Los Angeles, where they don't have much heat, but they certainly have a lot.
Yes, I mean, there is quite a, like you said, there's quite a big body of literature that looks at air pollution and student athletes. I personally have not looked at the two combined, but I know that Maggie Sugg, or Kovac, she was Kovac when she wrote the original article. She's Sugg now. She actually has incorporated air pollution. She's actually done some really interesting work most recently, and I don't know if it's yet, I mean, I know it's been accepted, but I don't know if it's out yet. Having groundskeepers wear wearables devices and measuring the impact on their body. And I think one of the things they're doing at the same time. Now, let me give you an example of why the issue with air pollution came up for us too, and why it's tricky. So we had the wildfires in North Carolina in 2016 after a prolonged drought in the western part of the state. The PM 2.5 monitors are actually fairly spaced out in North Carolina. We don't have a lot of them. And so that's been one factor that's been a bit prohibitive. We have learned that Clean Air Carolina has a program where it's basically crowdsourcing PM 2.5. I don't know if you've heard of this or not, but they have an app where people, and my hope is that that will lead to better, more research that combines the two in North Carolina. I think there's somebody.
Get the microphone so they can hear on the live stream, please.
Air pollution in the homes, because the increased humidity and heat encourages the growth of molds, especially in the basements.
And so can you repeat the first part of the question one more time? Oh, okay, okay. We definitely are seeing that mold issue in the coastal plain after the floods from Matthew and Florence. We have a significant mold issue in the eastern part of the state, which I think someone else has already pointed to, I think is also an issue here in West Virginia, post-flood.
All right, let me just leave the heat issue and move to the larger one. When I was doing some work on recruiting speakers for this conference, I talked to some people in the education department who talked about climate change education there, and I was really impressed by some extraordinary work, and I hope we get some of those people up here. But what's in the water down there? How come y'all are doing such a lot of, sounds like pretty good science that you're doing, and you're obviously getting some support from it, from your, I guess, your university system?
Yeah, so
That's, I mean, you get the
Yeah.
question, even though I didn't put it very well.
Yeah. So there's a couple I probably sort of mention too. I think Ed Malbach's study out of that, I think the pediatrician, I'm sorry, doctor, I forgot your name. Thank you. Mentioned about from George Mason's University Climate Communications. Ed Malbach runs that program. He's done a fantastic job teaching people how to communicate effectively on climate change. Susan Joy Hassel is another, and her website is climatecommunications.org if any of you are interested in materials that support that. Really cannot, she's written several articles about how scientists talk versus how community members hear. Like, for example, the word positive feedback. That is really an awful thing to scientists at times when we have a positive feedback going on, but to a non-science audience actually sounds like positive feedback. So, those kinds of things. So she's done a wonderful job, and so has Ed Malbach in that. As far as support in the Carolinas, so the NOAA's Climate Program Office and the RISA office has actually done a great job of supporting this kind of work, and this is the power of the RISA teams. And all of us all over the country are doing quite a bit of work. Texas and actually CLEMIS, which is the RISA program out of Arizona State, they have done an incredible amount of work. But there's a map. If you go to the NOAA RISA website, you can see who your RISA is. I would heavily suggest connecting with them.
We have one in Fairmont, West Virginia, that is a big supporter of West Virginia science teachers and provides equipment and climate education.
And believe it or not, the RISA program has actually done very well under this administration. This current Congress, there are a lot of RISA programs that do a lot of work on drought and farming and things like that, and so they've been able to garner a lot of support congressionally, and so we've not had enormous cuts in the budget like we had been, had obviously been afraid of. There have been some cuts, but they haven't been as massive. The regional climate centers, also under NOAA, this is the Southeast Regional Climate Center, but there are 9 of those all over the country. They've been less supported by this, and actually the first year of this administration, there was a threat to cut them by 87%, which would have put them out of business. But they are climate services, and so this is where you get a lot of your data, and all of us, all the researchers get all of their data. And so supporting your regional climate center is a great thing. And last year they slipped through without, they had a small cut, right? Not a huge cut. So, the NOAA programs that you don't hear a lot about are actually heavily supporting these community projects. And then, of course, the universities, too.
Yeah, the federal agencies just do so much work on this front, and we can't support NOAA enough, and so we definitely have been, fighting to keep the resources there, and RISA just does such great work, and some of the other agencies. We talked a lot about flooding. USGS is the agency that actually has the river gauges. NOAA has the tide gauges, which we've used the data for all of our sea level rise analysis, but there aren't enough river gauges to really get a full understanding of flooding. So we try to make sure that these types of science agencies have the resources and the support they need.
We'll have time for one more question.
I'm not sure if he can answer this or not, but I had heard that one of the first things that Trump did when he got into the office is suspend the floodplain mapping effort that was going on with the USGS. And is that true? Does anybody know? And what's the current state of that mapping program? Does anybody knows?
what I do know is, the Trump administration, or President Trump revoked a lot of good executive orders. And so what I thought you were going to say is he revoked the Obama executive order that would ensure that any kind of federal funding that went into construction or reconstruction would be basically built above the flood elevation, the base flood elevation, 2 feet for regular construction and 3 feet for critical infrastructure. As far as the USGS mapping, there's mapping that happens at a lot of the different agencies. So FEMA does some of the mapping, USGS does some of the mapping, and has some of the money for doing LIDAR, which is the light detection and radar. But do you know?
Well, I know also that the burden has been placed on states to update their flood maps. And so, of course, some states have been able to do so quite,
North Carolina has one of the best flood mapping programs. They did a really cool thing where they got federal money together and they got state money and I think maybe even private funds to do their flood mapping. So anyway, it's a good example if you all are looking for a good example for flood mapping. But I will say that as far as at the federal level in Congress, Congress is kicking the can down the road again on the National Flood Insurance Program, or NFIP. It's going to expire. The program, which includes mapping and insurance and reducing risk, is going to expire by the end of this month. So there's an extension on the continuing resolution that will extend it along with a budget till November 21st. And so anyway, I just mentioned that in a sense of that's the program that where we really need to see major reforms to get at some of these flooding issues and to be able to spend the money wiser and have better insurance rates that reflect the risk, have better mapping, and so on.
All right, another round of applause for Ashley Ward and Shana Udvardy. Before I send it over to Tom to send us home, I just wanted to thank you all for sticking around and coming out today. I wanted to thank all of our speakers for being here. They've taken time to travel and stay in a hotel in Morgantown and do all the necessary groundwork to come talk to you today, so I'm very appreciative of them. I also wanted to thank Jamie Van Nostrand from the WVU Law Center for Energy and Sustainable Development and Elizabeth Van Nostrand from the Mid-Atlantic Regional Public Health Training Center for helping to co-sponsor this event, and especially to Jamie for providing this beautiful venue and the lunch as well. With that, I will kick it over to Tom, and he will briefly send us home, apparently with a banjo.
For about 4 years, I've been doing programs, climate science programs, maybe 5 years in high schools around West Virginia, and I always tell the people who participate that we'll do this program, and at the end of each one of these activities, you will understand a little bit better what's going on with climate change. And then I check with them after each activity, and I say, do you understand better? And they nod their heads, because it's a pretty good program, and it sticks with them for... I tell them, now how long that's going to last, I really don't know. And but I have found when I go back to people like 6 months later, I see somebody at the grocery store or something like that, say, remember that program? I say, yeah, oh yeah, I remember that. And they say, well, what do you remember about it? I say, I remember that banjo. So and that's because before I do any part of the program whatsoever, before I even tell them what my name is, I get them, I go, almost heaven, West Virginia, Blue Ridge Mountains. I'm going to get you to sing here with me in it. Shenandoah River, life is old there, older than the trees, younger than the mountains, blowing like a breeze. Country road, take me home to the place I belong. Yeah, very good. Mountain Mama, take me home, country road. Well, thank you all very, very much for coming, and I echo everything Logan said. It was a great event. Thank you.